we're going to start with our myofascial case study today. So the first thing we're going to start with is a postural scan, and I'm going to look for different things called bowstrings. I'm just going to get you to stand normally, shake it out a little bit. Perfect. So just see that your right shoulder is slightly elevated. A little bit more of an arm gap on this side. So you have a bit of a bowstring here. I see a bowstring from your hip to about your knee, and then the other side from your knee to the inside, the lateral side of your ankle. Your left knee looks to be slightly higher. I'm going to get you to turn and face the windows for me. A little bit of hyperlordosis on the back. Nothing too, maybe from your glute to the top of your quadricep. I'm going to get you to face away from me as well. Still that right elevation on the shoulder. From this angle, I see more of a bowstring on the left side. And from the back, your right knee, the right back of your knee is higher. I'm going to get you to face towards the other wall for me, please. This shoulder slightly back because I can see more of your right shoulder forward, so a little rotated there. Perfect, and that's really everything. Okay, so I'm going to do what is called a stork test. I'm going to get you to face that wall away, and if it's okay, I'm going to palpate your S2 and your PSIS. Is that okay?
Yep.
Yeah, perfect. On this side, get your PSIS. I'm just going to get you to lift your right knee up just so I know I'm landmarked on the right spot. Perfect. And you can go down. I'm just going to count to your S2. So I'm going to get you to raise your right leg again for me. All right, that looks good. And then I'm just going to move my hand positioning. Right there. I'm going to get you to raise your left hand side. There's no movement there. All right. Now I'm going to get you to put your hands up over your head, both of them. And I'm going to get you to raise the left hand side. A little bit of movement there. And drop down. I'm just going to reposition my hands again. And raise the right side. All right. So I do believe you have some fascial tension. Things moved a lot better. Did it seem easier when your hands were up over your head?
A little bit.
A little bit? Perfect. All right, so I'm going to get you to lay face up on the table with your head over here, please. We're just going to check what's called your CCP pattern. So just relax that. I'm going to lift your head and relax into my hands. Just going to put you in a flexion. Rotate. So I move you to the left-hand side. That is a bit easier. Underneath your shoulder blades. Just relax there again. I'm just going to put some slight pressure up. Not by much, but it is your right side pushing towards the left is easier. Place my hands on your ribs, about 7 to 10. A little bit easier to your right hand side. And I'm just going to go underneath your hips here and do the same thing. And easier to your right hand side. Alright, so I'm just going to check your ribs as well, your rib movement. Touch here, and I'm just looking for, just breathe normally for me. For the posterior and anterior. A little sticky on your right hand side. We're going to go here. Same thing and breathe. Not much movement at all on either side. I'm just going to go one on top and one on bottom. Looking for a ballooning effect. So you're ballooning on my bottom hand and there's no movement up on below your clavicle. Do the same thing on the other side. A little bit of movement on your right side, but still seems to be stuck in inhalation. So I'm going to get you to flip over onto your stomach. You can stack your hands underneath your chin. So if it's okay, I'm just going to palpate your ischial tuberosity. Okay?
Okay.
With both hands. Perfect. And just take a deep breath in and out for me. Looking for a ballooning effect of your pelvic diaphragm. Looks to be even. The right side is a little bit more sticky. I feel more movement on your left. I'm just going to place my hand on top of your sacrum. And with inhalation, exhalation, I'm watching for nutation and counter-nutation. You got a little bit of a sacral rock there. Not too much, but it seems normal. So if your chief complaint today of a bit of right hip pain that radiates down your leg, I have seen with your bowstrings and your postural scan that you have a bit of altered mechanics in that area. Same with like some of your testing, which you've had a lot of trauma with your past injuries, so that's not a surprise. Contraindications for you, there was no masses present, no inflammation. You do have that PCL injury from about 20 years ago, so we're not going to do anything specifically to those ligaments like I wanted to. We're just going to steer clear of that because you did have that excessive ligament laxity when we did that PCL test. So we do our MFR treatment because fascial root can help relieve pain, help your mobility, help with range of motion. So I'm going to get you to lay down face up again. Just going to continue with a little bit of a functional assessment. I'm just going to check the tone. Is a bit more rigid on this quadriceps here, a bit of a round the clock. Yeah, I have adhesions. And at 5, 6, gets easier with 7. Just going to compare the other side. That seems pretty easy all the way around. Feel an adhesion here. No temperature change when I feel from one side to the other. So the first thing I'm going to start with is a lumbosacral decompression. So I'm just going to get you to bend this knee here. And I'm going to get you to roll towards me a little bit. So I'm going to place a flat hand underneath your sacrum. Perfect, and you can lay back. And the other one is just going to be on about your L5 here. Grab my stool, and we're just going to hang out, and I'm going to sort of pull in opposite directions. We're just going to wait for that to release. This could take anywhere from about 60 to 90 seconds to 10 minutes. I'm starting to feel a therapeutic pulse underneath my hand on your sacrum. Feel any change there? You are? Just gonna hold for another few seconds here. That was a big release. All right, I'm gonna remove my upper hand. I'm just gonna get you to roll towards me again. So I can remove this hand, perfect. You can lay that leg straight. Felt a little bit of change there. All right, so I'm gonna put my other hand, we're gonna do your pelvic diaphragm release. This is a global technique. Just gonna shear back and forth a little bit. I'm looking for ease of movement. This way. Down. hold this for a bit and then we'll move around. Further here. Seems good. Midline is not restricted anymore. I'm just going to come to this side. A little bit of a restriction here. Use the stacking property on this area in your 3 planes of motion. With your breath, I can feel my hand rotating more. There's a release happening there. Check. Spot here. Because we're on a bit of a time crunch here, I'm just going to move on, but I do feel a bit of a release happen in that diaphragm. Next thing we're going to do is your quadricep, your rectus femoris, and your sartorius muscle. They all sort of go together. There's a bit of a focal technique. So I'm just going to bend your knee and use my as a bolster here. I'm just going to find that your sartorius. On your ASIS, inferior a little bit, find the rectus femoris and your sartorius. And I'm just going to use this bit of a lever to sink my fingers in deeper. Alright, so now we're on that lateral border of the sartorius. Just going to keep that moving. I think we should bend a little bit more. Perfect. Just on that lateral border, sort of just peeling that sartorius muscle, longest muscle in your body that's shaped like an S. And your ASIS to the medial portion of your knee. So I'm just going to rock. Peel that from each other. There we go. Just go all the way down that lateral border. It's getting easier as I go down. You feel that?
Yeah.
Perfect. Just gonna lay your legs flat again. A little bit of change there already, but I do feel an adhesion right on your rectus femoris. Right there. Just gonna stack. Just use a cross hand technique just to sort of release that. Again, this could take anywhere from 1 minute, a few seconds to 5 minutes. My lower hand is starting to move so I can feel that release. As that fascia is giving away. motion. Just hold. That's already starting to feel that. Perfect. Yeah, there it is. So we're just gonna go to that very distal part of the quad. Just with my fingertips. Just gonna allow it to sink in. Adding a little bit of a twist. Very slow. The ease was counter rotation, so I'm going with the ease. Waiting for that to release. And then I'll go. Now it's easier, but easier going. Okay. Perfect. That would go really nice. And around the clock is much easier in that area. Alright. Just gonna bring you up, and with my modification for this one, I'm gonna find those tendons right in here. And I'm gonna, with my mod, I'm going to, since you're a bit larger than me, I'm going to put your leg up onto my shoulder. Just gonna find that tendon. I'm just gonna lean back. You feel my fingertips sinking in? Yeah. Just gonna readjust into one area and then lean back again. There it is. Perfect. Last one I want to do, so we're jumping back to a local technique. So I'm gonna get you to lay on your side facing the camera. I'm just gonna do this IT band, your fascia tensa lata. So for me, I'm just gonna find that glute med, or the TFL, not the TFL, sorry, the IT band. Just gonna hold that. I'm just gonna feel for adhesions. I can feel one right here. Just gonna stretch. Just gonna stop for a moment. I'm gonna put this in between your knees just for comfort there. You can bend that a little bit. Perfect. And back into that same position. Using that there. This also could be a modified technique because I can do cross hands. This is a bit of an alternative. Just with the size of your muscles, it's a bit easier to use my forearm. Alright, that gave way. I'm just gonna see if there's any more here. Right there. And that one gave way already. That was quick. Perfect. I'm gonna remove this. What we're gonna do is I'm gonna get you to stand in the same position that you were in earlier. Just gonna reassess that postural scan and also the stork test. So I did already check the around the clock. Just gonna look and look relaxed. Less of a bowstring on from your hip to your knee here. It has gotten better. The knee doesn't look to be as much higher. I'm gonna get you to face that way, please. for lordosis, but you have less of a down closer to your L5, S1, you have more of a dip, I feel like. Okay, let's do your stork test. I'm going to face the wall away from me. Just gonna palpate here again. Your PSIS. I'm gonna get you to lift this knee just so I know I'm placed right. Perfect. You have movement. You're good. Found it. And so I'm gonna get you to raise start with your right leg, please. All right, and down. And I'm gonna reposition here. There we go. And left leg. And down. All right, so hands up over your head again. So I'm going to start with your left hand side. Perfect. And then reposition and your right leg. Perfect. You had more movement. Did that seem about the same or easier with your hands up that time? About the same?
Yeah.
Perfect. That means we get some of that tension in your fascia out. Thank you.